I'm Eric Parker. Coming up this morning on CT21. A year ago this week, vaccines arrived in Connecticut. We're looking at how far we've come since then and what the Omicron variant means for how much farther we have to go to get through this pandemic. Plus, you may have heard about vaccine passports, also known as digital health cards. When are they coming to Connecticut and what will they be used for? We're getting those answers as well. Plus, Connecticut crews are on the ground in Kentucky right now trying to help those who lost everything in the devastating tornado outbreak last weekend. Plus, first night Hartford is a go, and for the most part, the annual New Year's Eve celebration will be back to the way it used to be. It's all ahead this Sunday, December 19th. CT21 starts right now.
From Channel 3, this is Connecticut's most watched current affairs program, CT21, with Eric Parker, sponsored by Hartford HealthCare.
Good morning, and thank you for being with us. 1 year ago, hope arrived in the form of vaccines. They were a game changer in the battle with COVID-19 in so many ways, but now we head into another winter contending with a new COVID variant. Here to talk about how far we've come and what we may be dealing with in the near future are Jeff Flaks, President and CEO of Hartford HealthCare, and Dr. Ulysses Wu, Chief Epidemiologist at Hartford HealthCare. I think probably the protocol will be to start with the boss, but I'm going to start with Dr. Wu, Jeff, if you don't mind.
Please.
Because everybody wants to know. They're hearing about Omicron. They're thinking about what's happening with the virus. As an expert in all this, what do you make of it? Where are we today?
It's a great question. Omicron is kind of the natural evolution of what a virus does. When you allow a virus or a disease to run unchecked, there's going to be a lot of viral replication. And so we're seeing a lot of transmission, not just in the United States, but around the world. And so when that happens, you're going to run into mutations. And eventually, it's Darwinism, it's happening right in front of us. That predominant virus will eventually mutate and win. And we've seen this. Delta overtook Alpha, overtook Beta, and we're going to see Omicron is most likely going to overtake Delta. And if we don't keep this virus in check, there's going to be another Greek letter down the road.
Jeff, I want to ask you about how everything's going generally at Hartford HealthCare. I think for so many of us, when we heard Omicron for the first time, we thought, oh, again, another one. You know, we thought there was light at the end of the tunnel, now this. It must be tough for your employees and your staff as well.
It's challenging circumstances, but Eric, I'll tell you, our team is amazing. All people today who are working in healthcare, on the front lines of healthcare, you know, they continue to rise to the occasion. They take care of us during our most vulnerable moments. And it is distressful and it does require a lot of resilience. But I just have to tell you, seeing the courage, the dedication, the discretionary efforts of our physicians, our nurses, every person on our healthcare team has been beyond inspiring.
Sometimes in these tough situations, it makes you even achieve more than you might have been able to otherwise. Now, operating at this super high level is almost routine. Is that kind of what you're seeing in the facilities?
Absolutely. You know, I've said throughout this crisis in healthcare, we have to be better than normal. You know, we're learning through this crisis and we're making improvements every day. We have to be adaptive, we have to be agile, and we have to have ingenuity. And our people are demonstrating it each and every day across all of healthcare. What's important is that our organization is safe. All of our hospitals are able to deliver these services. We use every precaution, and we're taking care of actually more people today than really ever before in this moment.
Dr. Wu, you said if we don't change our behaviors, there will be another Greek letter coming down the pike. I'm happy to report I don't even know what the next Greek letter is. You probably do. But to avoid having to find out, what are the behaviors people should be doing? So many wondering about kids coming home from college, about holiday gatherings, about meeting up with friends. What's your advice?
So the COVID fatigue is real. There's no doubt about it. People are tired about hearing about masking, vaccinations, boosters, staying safe. But what we're doing is that we have to realize that COVID has now become a social disease. And what do I mean by that? We are putting ourselves in situations where we could put ourselves at risk. And what we need to do is we need to take a step back and we need to look at the situations that we put ourselves in and say, hey, is that really something that I need to do? Because even if we do okay, we still run the risk of transmitting it to somebody else who may not do okay. And I know holiday gatherings are coming up, but if you find yourself in a holiday gathering, it's okay to put a mask on, like to protect yourself. So you've put yourself in that risky social situation, or if kids are coming home, or even kids who are staying in college, whatever it may be, take whatever measures you can to protect yourself.
And I notice you're not saying if you're not vaccinated, you should wear a mask. You're just saying take the measures no matter what your status is?
regardless of what your status is. We are certainly seeing people who are vaccinated who are developing breakthrough infections. Now, the big myth about this, and if you don't mind me expanding on this a little bit more, is that what people are hearing is only the vaccinated are getting infected. That is not true. The purpose of the vaccines was to keep people out of the hospital, or when they get into the hospital, to keep them safe, to make sure they don't get more ill. Now, we've certainly seen our share of people who have been vaccinated who have gone on to become very ill. By and large, it is still mostly unvaccinated. And so I don't want people to think that the vaccine is not doing its job. It's actually doing incredibly well. But it is not a silver bullet. They should still protect themselves, for sure.
Jeff, the last time we had you on was when you were at the Xfinity Theater, and I joked that everyone was so excited that to have Jeff Flaks headlining the Xfinity, everyone would be excited. But now it's sort of a different thing with the boosters. It's not these big mass sites in many cases. It's different. How's that effort going to get people in there and get those shots?
Yeah, it's going well. First of all, 18% of the population in Connecticut have the booster. We're running a big campaign right now. So we're pushing very hard during the holiday season. We're running commercials. We're reaching out to people in every possible manner to try to schedule people and get people to get the booster. And as Dr. Wu indicated, we're seeing, with very rare exceptions, people in the hospital who have had a booster shot. So we're doing everything we can to promote the booster, to make it as accessible as we can. And as we keep saying, we don't want to leave a single person, a single community behind in that effort.
For people who haven't gotten any vaccine at this point, is there still an effort underway, or has that ship sailed, do you think?
No, absolutely. We're working hard through education, through accessibility, even down to one-to-one counseling, whatever it takes to help people feel more safe, more secure, and to have people like Dr. Wu, our clinicians, explain the value of it and the impact it's having.
Dr. Wu, a lot of people are wondering as they try to find that appointment for a booster, does it matter if it's all three Modernas, if it's Pfizer, Moderna, if it's some other combination? What's your advice to people?
We've always said the best vaccine is the one that's in front of you, the one that you can get. You can mix and match your vaccines. You can even throw the J&J in there as well. So whatever vaccine is available to you here in the United States, get it.
What would you like to see as we head into 2022? Is there something, a marker, a milestone, something you'll be waiting for where you'll say, oh, where a lot of us maybe jumped to the conclusion and said, oh, we're good. As an expert, what's the milestone you'll watch for?
Right now, the wild card is Omicron. How dangerous is it going to be? We already know from the preliminary data that it's probably going to be more contagious. And once it's more contagious, we also know from the preliminary data that it can also replicate faster. But we don't know if it's more virulent. We don't know if it's going to cause greater disease. And that is important because if people are getting sick, but not sick enough to come into the hospital, then that's actually a good marker. So what I'm going to actually be looking for is the positivity rate juxtaposed on the hospitalization rate. If the rates are going up, but people are staying out of the hospital, that means either Omicron is less deadly, which is the hope, or people are getting their vaccines and getting their boosters. Hopefully a combination of all.
We've got about 10 seconds left. What will you be watching for from an administrative side? Obviously, it's such an unpredictable world in healthcare.
So we manage capacity every single day. So we're working on our capacity, our staff, and to ensure that we can maintain all of our services. You know, Eric, our ambition is to be here for everybody when they need us. And we're working hard. We have 33,000 people at Hartford HealthCare who are ensuring that we can maintain our services. And I just want to express tremendous gratitude to everyone who's working in healthcare in this moment.
I think a lot of people feel exactly the same way. Jeff Flaks, Dr. Ulysses Wu from Hartford HealthCare, thank you both for being with us, hopefully putting a few minds at ease here as we head into the bulk of the holiday season. Thanks for being with us.
Thank you.